focus my talk on women's health and bone. Women's health and bone is a very important topic to me because I think that it is something that is often misunderstood in both medical and non-medical circles, and it has a very important aspect on skeletal health. So what I'm going to talk about are hormones, and hormones are my specialty, endocrinology, but I know a lot of you are not clear on hormones and exactly what they do. Basically, what a hormone is it's a chemical messenger. It's made in one part of the body, and it travels to other parts of the body to carry out its actions. It's sort of like that game telephone that starts with one person and goes around in a circle, and then that last person at the end has to tell you what the message is. That's what a hormone does. We have two important glands that control all of the hormones in the body. They're called the hypothalamus and the pituitary, and they sit right near each other up here in the midbrain. These are glands that basically decide how much of each hormones are made by the body. And they do so by listening to the body and getting feedback. So they look at the levels of these hormones in the circulation, and based on whether those hormones are high or low, they tell the body to make more or less. So estrogen is the key hormone in women's health that helps determine bone strength and bone density. Estrogen has two important effects in bone. So you have your bone building cells, which are here on the right. They're known as osteoblasts. And osteoblasts build bone. Estrogen works directly to positively affect the osteoblasts and tells them to build more bone. Then you have these other cells over here. These are known as osteoclasts. Osteoclasts eat up that bone because building bone is a balance of building new bone and breaking down old bone. And what estrogen does is it tells these osteoclasts to break down less bone. So it really has two positive effects. It's both building bone while telling your body not to break down bone too quickly. I'll say a little bit about the menstrual cycle because this really determines estrogen levels in a woman. Once a woman begins menstruating, these estrogen levels actually fluctuate throughout the menstrual cycle, which is roughly about a month in time. In the beginning of the menstrual cycle, estrogen levels are low, and as the cycle continues throughout the month, the estrogen levels rise. And at the end of the cycle, the estrogen levels drop again. We know that estrogen levels do not act alone in a vacuum. They're based on several other hormones that act in concert. A normal menstrual cycle, meaning that a woman is not on a birth control pill to regulate her cycle, not using an intrauterine device, not getting Depo-Provera injections, just a normal menstrual cycle without anything from the outside, is something that should occur in a woman's body every 21 to 35 days. If cycles are longer or shorter than this, there could be medical issues that make ovulation, the release of an egg, unlikely to occur. The release of an egg or ovulation is really the purpose of a menstrual cycle. But we know that in addition to interfering with ovulation, having menstrual cycles that are outside of this 21 to 35 day window can mean that estrogen levels are insufficient to positively affect bone, and there could be negative effects to bone happening. On average in the US, women start menstruating around age 10 to 14 and continue to menstruate through age 50 to 51. So as you can see, it's many years go by when these estrogen levels should be in the woman's body, helping to build bone and maintain bone. A woman's last menstrual period, so a period she has somewhere between age 51 and 53, is known as menopause. And we know that when women hit menopause and stop having these menstrual cycles, they tend to start losing bone. And women will lose the most bone most likely in the first 5 years after menopause. So what happens in this menstrual cycle? As you can see here on this graph, it is a complex interplay of several hormones. I'll focus on a few of them here. So first what happens is that the brain, the hypothalamus and pituitary gland that we mentioned, tell the ovaries when to make estrogen and how much. The pituitary gland makes a hormone known as FSH, which travels in the blood and signals the ovary to make estrogen. This estrogen is made by the ovary, and then it sends a signal back to the pituitary to make another hormone, LH. LH then tells the ovary to release an egg, which is known as ovulation, and it also signals the uterus to make progesterone. Signals the ovary to make progesterone, which then increases the size of the uterine lining. So at this point, there's an option for fertilization. If there's sperm present, the egg will get fertilized and a pregnancy will begin. But if there is no sperm, the uterine lining that's built up by this progesterone level will be shed, and this is known as a menstrual period. There can be many things that disturb this cycle. As you can imagine, it's a very complex cycle with many different hormones at play. Some of the common things that can affect the menstrual cycle that I see here at HSS include people who have low body weight from a variety of sources, either due to excessive exercise and or calorie restriction, just not consuming sufficient calories for the amount of exercise that someone is undertaking. These can interfere with the hormonal cascade that leads to menstruation. Also, if someone's body is deprived of nutrients or is severely stressed, let's say someone has a chronic illness or an acute illness, the hypothalamus will actually not make the key hormone GnRH that starts the process leading to estrogen production. So when someone is underweight, severely stressed, has increased exercise compared to their caloric intake, this GnRH at the hypothalamus level turns off, and then the pituitary does not make the FSH to tell the ovary to make estrogen, so the estrogen is not made. And basically what happens ultimately is that bones will suffer. If this happens when women are younger than age 30, they might fail to achieve their peak bone mass, which then increases their risk for osteoporosis when they go through menopause. We also know that when this happens, there is an increased rate of bone breakdown, and this leads to an increased risk of fractures, of broken bones. We often see stress fractures happening, especially in athletes and non-athletes. There is this other menstrual cycle disturbance that we commonly see that's associated with low estrogen, and it's known as the female athlete triad. This is basically defined as an energy imbalance where someone has low intake of energy but excessive energy expenditure, and it leads to menstrual cycle disturbances and low bone density. So this is really something we can measure because we can measure bone density in these young female athletes and see that it's lower than their peers and lower than it should be. Severe emotional stress can lead to low estrogen levels and menstrual cycle disturbances, prolonged illness, and also eating disorders. So there are treatment options available for the low estrogen state. Treating the underlying cause is really the most important thing. That's often hard to do, especially if someone is very chronically ill with an underlying medical condition, but trying to restore them to optimal health as soon as possible is the best strategy. For the women with the female athlete triad, we often encourage them to have a team approach, to work with a sports medicine doctor, to work with myself or another endocrinologist, to work closely with nutrition and try to match their energy intake to their energy expenditure to try to bring their period back and improve their bone density over time. Weight gain to restore menstrual cycle is often necessary, especially in the female athlete triad. A lot of patients are underweight, and without having a sufficient weight, this pituitary gland will remain quiet because it will not get the signal from the hypothalamus to start making FSH. And lastly, estrogen replacement therapy is also an option to give back the estrogen that women are missing.